podcast. 21 day. Hello, everyone. It's Diane, the massage mentor, and I have a very special visitor, my dear friend, Dr. Scott. Now, I have been watching Dr. Scott from afar for many years, and I have this way of finding these. The universe has, I should say, this way of bringing me these awesome people. And Dr. Scott is the founder of the Phoenix Trauma Center outside of Philadelphia. And he is one of the most gentle, brilliant, intense, funny, great humans. And I'm so honored and thrilled to have him here. And he deserves that Dr. Scott in front of his name because of all his hard work. So, Scott?
Thank you, Diane. I appreciate the very warm and exciting and passionate introduction. Hopefully I can live up to your kind words in our time together here. I'm excited to be with you and with everyone who's watching.
One of the things that we've talked about in our, we like to pal up and have little chats now and then is trauma and then massage therapist. So one of the things that I've always done, and I didn't realize it until some of our conversations, was when someone walks into Freedom Massage, they are about to walk in and meet a stranger, probably a stranger, and then they're going in a strange office. They don't know anything that's going on in the office, really. And then they have to walk upstairs or walk into this room with music playing, and then they have to take off all their clothing.
Right. And the lights go off.
The lights go off. And then you have this person that you just met working on your body. Now, some sessions even leave on their clothes, Now we have some sessions you leave on clothing. But even still, someone's definitely in your personal space.
Right.
And one of the things that I was unaware of until speaking to you is how much of the population suffers from some kind of trauma.
Yeah, in the research, it's pretty alarming. 7 out of 10 people report some sort of trauma.
7 out of 10 people. So would you be in agreement, and would you say that it's important if a therapist is seeing a client for the first time and maybe greet them with some enthusiasm and kindness?
Yeah, perhaps as much as you bring to the podcast here.
Yes.
Make them feel welcome.
Make them feel welcome.
Yeah.
Show them their surroundings. Show them the exits.
Yeah.
Show them around the massage room.
Yep.
Show them around the massage table. Show them the headrest. Show them where they're going to put their clothing.
Right. Show
them that you're going to wash your hands, that there's hand sanitizer. All those things are not just rituals that we should do to be professionals. Could you tell us why they're rituals or things that we should do to protect the wounded hearts or the people who may be suffering from trauma?
Yeah. So trauma is usually characterized by a loss of choice, autonomy, and it's usually pretty unexpected. So anytime we're working with someone who might be a trauma survivor, and if you're working in human services of any kind, you're working with someone who might be a trauma survivor. We want to, as much as possible, provide opportunities for clients to be empowered to make their own choices, to set boundaries when needed, and to really give them, before we begin any kind of work, and almost like an itinerary of this is what the plan is. And let me know if there's anything that doesn't fit for you in this plan. I start all my groups off when I'm doing psychotherapy with, this is what we're going to do today, so that there's no surprises. And I think the same principle fits for massage therapy. Going through, I'm going to start working on this part of your body and move to this part and move to this part. And then we're going to, switch position and just going through what might feel like really mundane, boring details for someone that's doing it all day might be really important for a trauma survivor to know what's coming.
Especially, right, because the goal of massage and body work is to bring down stress levels. So
Right.
if the person comes in your office, that little bit of trauma, and we were saying, talking a little bit earlier too, that sometimes trauma victims might not intellectually recall the trauma, but the
Yeah.
trauma will be sparked by different actions or reactions to things, and they don't even know necessarily that they're having a trauma response. So our behavior could have an effect on them, and they might not even be aware. So the more gentle we are, speak to that for me.
Yeah, absolutely. It's quite common for folks to minimize their trauma, to not acknowledge or label something as traumatic, and potentially to even repress or dissociate entirely from traumatic memories, and really have no conscious recollection of those memories. And when trauma, so we'll talk a lot during this interview about how trauma is stored in the body. It's not just a theory; it's a real thing. Trauma is really stored in the body and in the nervous system. If you look at a list of the symptoms of PTSD, post-traumatic stress disorder, they're almost all symptoms related to the nervous system. And when you have someone on the massage table or chair and you're working on their body, you're working with the nervous system. Anything that you can do to help that person feel safe, feel secure, is going to help with a sense of safety and help calm down their nervous system a little bit. In psychotherapy, we always say that the most important aspect of the process is the therapeutic relationship between the therapist and the client. And that safety really comes from that container we create together. And I know massage therapy, there's usually less kind of verbal exchange than we would have in psychotherapy. But I think there's really simple ways that before a client gets on the massage table, to establish connection, to establish rapport, and even throughout the session to have a little bit of communication with a client if they're up for that. I think you can really consciously use your relationship with the client to help them feel warm, welcome, and safe. Relationships is really one of the primary ways that we as humans regulate our anxiety and our stress.
And so basically, if you forget your massage cream, you don't start the massage and just walk out and then come back in without telling them that you left and came back in. Stuff like
Yeah, that would be
important. But you'd be surprised. You'd be surprised. So one thing too is the I think some people, as we're talking about trauma, might not even know. They feel guilty to name it that. Like, unless their PTSD gets and should be, of course, parallel to vets and people who have been through wars and all that stuff. Of course, PTSD. They hear loud noises. They're all that kind of stuff. But can you tell us some other examples of? Trauma could be, where we might not even realize or be able to call it that ourselves. Could you give me some examples of that kind of thing?
Yeah, absolutely. So trauma is really a subjective experience. So someone might have a traumatic response to an experience that someone else might not have the same response to. Two people could experience the same thing, and one of those people might identify it as traumatic and the other person might not. I think there's a lot of factors that go into that, especially culture and value and the ways that we make sense of our experience in the world. I like to think of trauma as any kind of experience that overwhelms our ability to cope. That's a simple way of thinking about it.
Mm-hmm.
And that trauma is on a continuum. So there's capital T traumas, the types of events where, 9 out of 10, 10 out of 10 people would say, oh, that's a traumatic event. But there's also these lowercase t traumas that usually go unnoticed, or sometimes can go unnoticed. They can be neglected. However, especially when they're reoccurring, these lowercase t traumas can really have the same impact over time that a capital T trauma could have. Things like repetitive bullying, things like neglect or abandonment. So often we neglect to consider how impactful neglect is for people. And especially in the context of massage therapy, thinking about how if we're working with someone who maybe didn't receive a lot of physical touch and love growing up, how powerful that physical touch, if it's done in a safe way, how powerful that could be for someone.
Yes. Do you want to hear my silly little thing that I always say? I always say one woman's, if you're in the right town, one woman's broken fingernail is like another woman's broken arm. I know that's extreme, but some women, for them to break a nail is like, who am I to judge? I mean, it might really blow a whole day for them. It might be a big thing. And on the other level, it may take a more serious injury or stir up, like you were saying, for someone to be affected. And I think that it's important to keep that in mind as we even walk through life, that you never know where the T is. Is it capital T or is it lowercase t?
Right. And it's important to also acknowledge in this conversation that humans are incredibly resilient.
Right.
And actually, more people report growing from trauma than developing post-traumatic stress disorder.
Yes, it is. I do believe that everything that we can in life, we can definitely use as a teacher or a guide. And you were saying too, one of the things you wanted to discuss was how the body will store trauma.
Yeah. So if you haven't read it, there's a really good book. I know you've read it, Diane. There's a really great book called The Body Keeps the Score by Bessel van der Kolk. It's basically like the Bible for trauma therapists. I recommend it to all my colleagues, students, trainees. It's a book on trauma, and it's called The Body Keeps the Score. So a lot of the content in it would be really relevant for massage therapists. And basically, in the book, Bessel goes through all the different ways that the body, the nervous system, and the mind are impacted by traumatic experiences, different types of traumatic experiences, and different ways of healing from those impacts. So the past 2 decades, the neuroscience research has really been evolving like crazy. And we know a lot more about how trauma impacts the brain, not just the mind, but the brain and the body than we used to. And even then, we still know only a little bit compared to what there is to potentially know. But there's been some studies that I think are relevant for massage therapists to consider. One of which is that when somebody's traumatic memory is triggered and they take a scan of the brain, the speech and language center of the brain is offline. So if we are working with someone who is a trauma survivor, or could be, and there's a possibility that physical touch could be triggering for someone, they might not be in a place where they can articulate a boundary or give voice to what's going on for them. And that's not their fault. That's just how we're wired.
Right.
So really, before getting started, checking in about permission, about physical touch, really getting thorough, informed consent would be really important. And keeping that in mind throughout the process, that although someone might not always be able to verbally articulate what's going on for them, you can look for nonverbal communication. You can see and feel what's going on in the body, and make corrections based on that. I'm a bit jealous of you all as massage therapists. As a psychotherapist,
right,
I'm not really allowed to engage in much physical contact with my clients. And I imagine there's so much information about the client's body and about their trauma and healing. maybe this is also a good point just to acknowledge too that I'm not an expert in massage therapy, and I really want to approach this in the spirit of humility, to share a bit about what I know about trauma and the body, and as a client and customer of massage therapy, a regular, some ideas that Diane and I have been throwing around that could be helpful. But I really want to acknowledge I'm not an expert in massage therapy and throw that out there.
Well, that you make a really good point on how the two kind of work well together, because you can talk them through it, but you can't really feel them. I can feel them, but I can't talk them through it. And
Right.
if it gets triggered, I don't know what to do. So do you have any insight? One of the questions from my staff was, make sure you ask him, what would he say we should do if someone has some kind of reaction as we're working on them? Does he have suggestions on, say, the client, we're working on them? I mean, now that you're saying this, honestly, Scott, I've thought of people that have been like, I'm sorry, I have to stop the session. And I always took that personal. And in maybe some cases it was personal, but maybe in some cases it was not personal and they couldn't take the touch. So what would be some suggestions?
Yeah. So if someone's actively having a emotional response in a session,
Yeah.
I would stop or really slow down what you're doing and check in with the client, maybe help facilitate them in some deep breathing. Deep breathing is so simple, but the quickest and most effective and consistent way to regulate the body and the nervous system. Just long, deep breaths, exaggerating the exhale. It starts to tap into the parasympathetic nervous system, which will stop the production of cortisol, which is a stress hormone, and it'll help calm someone down. So just reminding someone to breathe, although it's so simple, it's really the first thing to do. And I would check in with them and see what's going on. Of course, not being trained in psychotherapy, you have limits on how much of that you can facilitate with them. You can validate what's coming up for them and acknowledge it's not entirely abnormal. You're not the only person that this happens to.
Right. Yes, that's a good point. That is an excellent point, Dr. Scott, because that is, I think, one of the things that is really helpful when people move through those things is that you're not alone. You're not the first person that's had a cry on my table. I mean, I wouldn't say it like that, but I can't tell you the number of people who have cried during a massage or had some kind of emotional reaction. So I think that's a really incredible point that you just made, is letting them know they're not alone and validating their feelings. Yeah.
Yeah. And it's less about what you say to them in that moment and more about that you're a steady, attuned, non-judgmental presence. And in order to be that kind of presence, usually it requires that we do some of our own work so that we're comfortable with other people's stress and emotions.
And that was another question. You want the other one that this one therapist had asked me? Is she said, well, what do we do if we're suffering from trauma, or maybe we're not aware of it and somehow we get triggered? What are your suggestions for that? That's a tricky one, huh?
Yeah, that's a tough one.
And like I said, I know you're not a massage therapist. We understand we do have some guidelines for this, but I'm just curious to see what your point of view would be, because I would guess as massage therapists too, if you're acutely aware of like your own stuff, like you said, we have to do a lot of work on ourselves in order to meet people where they are. So do you have any exercises that someone could do, say like post or pre-session? The breathing you said was one.
Yeah. So taking a few deep breaths is a simple one. Any kind of positive imagery, just kind of using your imagination, checking in with yourself, tapping into perhaps a positive memory where you really felt grounded, felt confident, felt safe. The mind is really an incredible thing. and the body can't really tell the difference between something happening in real life,
Yes.
a dream or a nightmare, or when we fully surrender ourselves to imagination or replaying a memory.
Oh, say that again. No, that one, I think that I love that. Like when that started to sink in my head, that my body, go ahead, say it again. Say it. You said it good.
So the body can't tell the difference between something happening in real life or a dream or a nightmare, or when you really give yourself to your imagination, daydreaming, remembering a memory, whether it's positive or negative. I like to remind my clients that, maybe I'm in a unique situation because all my clients are coming to me to work through their trauma. So they have the experience of past memories causing them pain. I remind them that, just like the negative memories change how you're feeling right here and now when you think of them, you have some positive memories in the past that when we tap into them, they can change how you're feeling right here, right now. And that goes for us as therapists, no matter what kind of therapist or professional that we are, resourcing ourselves, tapping into our own internal resources, our own positive memories. Another useful visualization is a container, imagining some sort of container, physical container that, if there's something you're experiencing that might prevent you from being present with a client, that you could imagine taking that negative thought, that negative belief, and just putting it in the container, not to detach, not to dissociate from it, but to contain it in a healthy way so that you can come back and deal with it later.
I like that.
Really simple.
I like picture this little man like, let me out of my box. Let me out.
Right.
Let me out of my box.
Right. If you leave it there for too long, it'll start yelling like a little man stuck in a box. So it's important that we go back and deal with it at some point.
Yes. Yes.
And the other thing is, like for myself as a trauma therapist, picking up vicarious trauma for others, one of my go-to strategies for working through that is getting my own massages.
Right.
And I think that that can be a really simple thing for massage therapists too. Getting your own massages.
I think that I really, I don't know what you do doing your massages, Dr. Scott, but I have built a business. I have healed my own trauma, a lot of trauma. I feel not like I've healed my own trauma, but I've processed a lot of things in my body, because that's another thing. Everything my body's been through, it's probably still there, when I got to work through it. So there's been so many things that I've been able to do as a massage therapist. And that brings me to the point too, that I think it takes time to learn how to receive massage too. It's not just, as our clients come in, their first massage, they are not necessarily expert receivers.
Right.
It takes time to learn. My sessions now, after 20 years of receiving massage, I'm like, do whatever you want. I'm just like, I can't, I'm there. I go to a different little safe place where I'm happy I have a body and I'm thankful for everything in my life. And it's just this blissed out time for me.
Right.
So I don't even know what I was talking about, because I just got so blissed out talking about where was I, Dr. Scott? I don't even know.
The way I think about it is our warming up process to receiving.
Right.
So
it does, yeah.
Someone who's experienced trauma, perhaps, and maybe isn't as comfortable with a stranger touching their body, their warming up process to receiving a massage is going to be a lot longer. It's going to it's going to need to go slower, gradual. It's going to take some time for them to warm up and feel comfortable and safe.
I think it's important to meet them where they are. I had a woman that felt most comfortable leaving on her pants for, I think it was like 3 years. I remember the day that I finally went in that massage room and she said, I'm ready for you to work on my legs.
Yeah.
I was like, oh, I was so excited for her. I was so excited for me, but I just, we did that journey together. And it's not that she's any less than or anything. It just was her process. So I think what you're saying too is it's really important to meet people where they are and
Yeah.
not push them to a point, because that could cause trauma in itself.
Absolutely. I mean, if you think about most experiences of trauma, there's a violation of a boundary that happens. And as professionals, we want to avoid reenacting that in any way, even the smallest way. So we really want to respect clients' boundaries and help empower them to have those boundaries and set them, which can be tough with massage too. I'm thinking of even my own experiences. The massage therapist will say, all right, let me know if it's too hard. I know you said you like really firm, deep massage, Scott, but let me know if it's too hard. And a half hour into it, I'm like, oh, this really hurts. Why am I paying her to hurt me? And it can be hard to speak up and say, this hurts a little bit. Can you relax?
It's true, right? It's more reason for, I'm surprised you haven't been to Freedom Massage for your regular massages. We'll talk about that a little later. But that's another good point, is we can't always count on the client to have that voice. That's why for me, I always ask, would you like less, more, of the same pressure? That way too, it helps them. They don't have to say yes or no. They don't have to feel like they're hurting my feelings. They can say, I'd like a little less. I'd like a little more. Oh, the same's fine. You can sometimes hear the person say, I'd like the same. And they're like, oh, I like the same. And I'm like, you don't want the same.
Yeah.
You said you want the same, but I know you don't want the same. I'm going to guess that, oh, I don't want the same. So there is different language, I think, too, that we can, to your point, use with clients to kind of make sure that they do have that voice and that their voice is heard.
Yeah. And that might mean, especially in your first session or first couple sessions with someone, checking in a little more often than you might with more regular clients. Is this okay still?
Right. 100%. What else do you want to cover, Dr. Scott? What else? I'm definitely going to beg you to come back. So what do you want to cover? What else? Anything else today?
Yeah. So some other things I wanted to throw out there. In preparation for this, I was looking a little bit at some of the research related to chronic pain and childhood trauma that I thought would be interesting for some of your listeners.
Yes.
There was this groundbreaking study they did 20, 30 years ago called the ACE study, Adverse Childhood Experiences Study, where they looked at the correlation between adverse experiences in childhood, trauma, neglect, abandonment, abuse, family dysfunction, and correlated it with mental health and medical issues in adulthood. And they found a connection between, medical issues with the body that we normally wouldn't think of as being related to childhood trauma. Things like heart problems, diabetes, cancer, lung diseases, chronic pain even. They found that when someone has childhood trauma, they're 200% to 300% more likely to develop chronic pain as an adult.
Oh,
Pretty significant.
and for me, hearing these things is, we were talking about it earlier. I've had my hands on people for tens of thousands of hours. You can't do that much massage and not just kind of feel things. You can't hear someone reporting their condition to you, doing a client intake, and not noticing the subtle clues in their voice or the way they stand, or perhaps the fact that they might not look you in the eye, or they kind of almost seem like they're frightened, or their shoulders are up. So if I'm hearing you correctly, that there's now some I'm waiting for the science to catch up all the time,
Yeah.
Dr. Scott. I'm always waiting, because there are always things that I've noticed just by the way people feel. Their body literally, we were talking about earlier, their muscles actually feel that would lend me to believe that something has happened and it might be happening over and over for them. So you're saying now there's actually evidence.
Right. And if you think about, the normal trauma responses that we talk about, fight, flight, and freeze, all of them are characterized by a tensing and bracing, or in a energizing of the muscles, all of the muscles in the body. Maybe different ones related to different responses. Like a fight response might have more upper body muscle tension. A flight response is going to have more leg muscle tension. Freeze response is probably going to be a whole body tension, freezing.
Right.
The metaphor I use for it with clients is that it's like you got one foot on the brake and the other foot on the accelerator, and your body's just being pumped with adrenaline and stress with no way to let it out. And so the body holds on to that somatic energy. It gets stuck. There's a frozenness that stays with the client long after the trauma in some cases. And sometimes what you experience with a client when they have a breakthrough on the massage table is that they're discharging some of that somatic energy that was locked in the nervous system that they haven't been able to get to in any other way. Just talking about it in therapy isn't going to get there. They really need to do some body work. I recommend massage therapy to most of my clients. I think it's really helpful as an adjunct or as a complement to psychotherapy for someone working through trauma, helping them befriend their body again. I mean, someone who's experiencing the negative impacts of trauma, post-traumatic stress, they're at war with their body, with their nervous system. So any kind of practice that can help them find safety in their body, find appropriate pleasure in the body, tolerate being in the body a little bit more is going to
almost bring them back into it.
Yeah, or sometimes completely bring them back into the body. Yeah,
because I'm guessing if a trauma, I always look at trauma to a degree is, we're living from here up. We're living in our minds. A lot of people, because their head's racing, even if it's just stress or thought. So I'm living from here up, trying to think my way through life. La, 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 la. And all of a sudden, there's this drastic disconnect from the whole present moment, from my body, and from who and what I really am. Like, there's no more connection. It's all up here.
Right. Yeah, right on, Diane. Exactly. And it's why in my field, in the trauma therapy field, many of the experts are suggesting that talk therapy isn't enough for working through trauma.
Yes. You have no idea. I think it is. Like, you can't sometimes, I always say, sometimes you just can't talk it out. You can talk. And then then it might say, well, you need to take action. Well, if your body's frozen, if you're terrified to be in your body, perhaps befriending your body again is a major player in helping people with trauma and helping them through traumatic experiences.
Yeah, exactly. There was an interesting study where they found that yoga was more effective at reducing PTSD symptoms than any medication that's ever been researched, which is just amazing. And I imagine that, of course, yoga and massage are very different, and there's some similar elements.
Right. The
process of finding safety and comfort in my body, the process of tolerating a little bit of distress. If I have a real sore spot and a massage therapist is getting in there, it hurts a little bit. I know it's going to be temporary, and I can breathe into it and tolerate a little bit of distress, knowing that I'm going to have relief shortly. Just like holding a massage pose that is a stretch and it hurts, but I know it's going to be over soon.
But that's the thing that I always go to. as a receiver of massage for a long time and then doing these yoga poses, it's like I have to unravel my thoughts in order to unravel that knot. Like you're saying, you have to yield to the touch. Like I believe I can breathe into something and have it kind of loosen or unravel, at least temporarily. You would hope ideally forever.
Right.
But you can't, you have to get through your mind in order to have the body relax. And with yoga, you're pushed to a point and your body says, ha, 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 no way. And your mind's like, okay, that's cool. And then there's like this thing that happens with your breath and your body. And then the two have to unite. There's no way to get to the next level of that stretch unless your breath and your body and your brain unite to get you there. And that is, you can't be thinking when you're doing that shit. You can't be thinking about what you're buying for lunch and getting rid of a knot in your back or getting into downward dog with your ankles on the floor.
Right. It raises a really good point, Diane, that part of the healing process is reconnecting the mind and the body.
Right.
And psychotherapists, we do that in a top-down way usually.
Right.
And massage therapists, you do that in a bottom-up way.
Oh, look at that. This is what I mean. Like here, and I just wish, we're always talking like bringing our industry up a notch. Let's bring it up a notch. And a lot of us have done it by naming muscles, doing this, getting better with our the way we speak about the human body and all that, which is wonderful. It's great. But also just getting back to the importance of touch for just healing the human being. Not healing the human being. I don't consider myself to be, but helping the human being heal themselves, just getting them in their body. And so often when a lot of these mental blocks are gone, the body is jonesing. The body wants to be pain-free. The mind does not like pain, right?
Right.
So it wants to be free, Scott. Dr. Scott, it does, right?
Exactly. And just another point to really drill home, in the neuroscience research, when they look at someone's brain in physical pain, like you're talking about, and someone's brain in emotional pain, you can't tell the difference.
Look at that.
You can't tell whose brain is whose. The brain, the way we've evolved as humans, is that the mechanisms in the brain and body for physical pain are the same ones used for emotional and social pain, which really drills home the point we were making earlier about the importance of the therapeutic relationship and connection, attuned presence, how really being with someone, even if it's without words, being attuned and present with them to the, they can feel, a client can feel it if you're checked out mentally while you're doing a massage, or if you're really attuned to them, that by itself, the relationship, the attention, the attunement is going to help reduce their physical pain and stress.
And I honestly, I mean, everyone's like, how did you build your business? And probably people are like, Scott, how did you get together with this Phoenix Trauma Center? Oh my God. And that is the number one way, was when someone walked in the room, they would always say to me, Diane, you make me feel like I'm the only person in the world. And for that hour and 10 minutes, most days I did, but I wasn't perfect. I'm human, but I did my best once they came in to make it all about the client. And they feel that, they tell their friends about it. And that's how my business grew, was just really being there. And I love the statement too. I heard once, Dr. Scott, we listen to understand. So listening is, you want to understand. So people feel that too. Like when you're really there, listening to what they want from their session, whether it be a session like with you or a session with me, it's important that they feel heard. That's going to probably help some of the protectors too, right?
Exactly. Some trauma experts are suggesting that the traumatic nature of an event has less to do with the actual event and more to do with if there was an attuned, supportive, healthy person after the event.
Wow. Yes, I've heard that. I've heard that one. Wait, say that one again too.
So for some people are suggesting that whether someone has a traumatic response to a traumatic experience has less to do with the trauma itself and more to do with the aftermath of the trauma. If there was or wasn't a supportive, attuned person that was there for them. And many times that person is you as a massage therapist, me as a psychotherapist. Sometimes it's long after the trauma. And especially important now in a global pandemic where there's so much additional disconnection and lost presence, really being with someone.
And you just made a great point. I want to run with this one. And it could be a delayed response. So meaning like someone could come into my office after a horrible trauma as a kid. Horrible. Maybe things that we couldn't even talk about live on Facebook. That we just wouldn't, right? So
Right.
whatever's happened has happened, and it was gone unacknowledged for say 20 years. And they come walking into my office, and maybe I'm the first person to meet them eye to eye, greet them, and be excited about them being there. So you're saying that if there is a delay, that we can always help people.
Yeah, we can provide what we call them in psychotherapy, we call them corrective emotional experiences.
Oh, I love that.
You know, when we have a traumatic experience, it leaves an imprint in the brain, the body. It changes us, or has the potential to change us. And new positive corrective experiences also have the power to change us.
Yes.
And so if you're working with a client who perhaps never had attuned presence growing up in their life, caregivers weren't around or were abusive or just didn't provide the love and attention that someone needed, and they come in and get an hour of undivided attention from you as a massage therapist, that's a corrective experience. That's incredibly powerful and healing for someone.
And that's, like I said, these are all the little subtle things that I wanted to talk to you about, because sometimes, you're doing massage for 20 years and you're like, I'm not making a difference. I'm not making a difference. You get that whole, whoa. But the honest answer to that is if you greet a client with enthusiasm, you do your best from beginning to end to be with them. Right. You're making a difference.
Right.
That right there is making a difference. That you showed up, you suited up, you're there, you're excited they're there, you're there for them. You put aside your BS for an hour and 20 minutes and you're there. So already you're saying, if I'm hearing you correctly, and I want everyone to let this sink in, is that we're making a difference.
Right. You might be the first person that a client has an experience of safe physical touch with ever, or since experiencing some sort of physical or sexual abuse. You might be the first experience of safe physical touch that someone has. And that's amazingly powerful for them.
And life-changing.
Exactly. Yeah.
So, and like I said, for me, I've always been really sensitive to that kind of stuff, and I feel like it's important for people to take it that serious. Every client that comes in, that's an extreme way to look at it, but I haven't really dove that deep into my realization of some of these things, that person you could be the first person to touch them since a really horrifying experience years ago that they might remember, they might not remember, but what an honor.
Yeah.
To be that person that we could be a part of corrective thought techniques or experience.
Corrective emotional experience. Yep.
We could be a part of corrective emotional experience. Our presence, our session could be that. It could be that serious. It could be that deep.
Yeah, exactly. And it might be in really subtle things like asking permission.
Right.
and honoring someone's boundary.
Yes.
It might be as subtle as, is it okay if I dim the lights? Is this too dim, or is this not dim enough?
Are you warm enough?
Yeah. Yeah,
You want another blanket? Are you comfortable?
exactly.
And put your clothing there.
Yep. Another thing is,
Leave it on.
yeah, absolutely. Absolutely. Empowerment and choice. Another thing that came up in one of my trauma therapy groups recently is the placement of the door compared to the client. A lot of trauma survivors don't like to sit with their back to the door. So as best as you can, positioning your room in such a way that the client can get to the door if they need to, and they don't feel like they can't see the door or their back is to it. Something as simple as that normally we wouldn't think of when we're furnishing our offices. That goes a long way for a client.
Unless, of course, Scott, you've studied feng shui. And you always have to have a visual eye at the door. But that's one of the things that I feel like is another part of when our clients come in, they get, like, we call it a little tour. Because I've known enough people in my days of working with people in recovery and all kinds of stuff that they want to know where the door is.
Right.
They want to know where the door is. I got to show them before they take off all their clothes. If they need to get out of here really fast, where is the door?
Right.
So all these subtle clues are making a difference, and I feel empowered by this conversation more and more, because these are all little things that I've been doing all along, and I think that that's why people feel the difference at our practice.
Yeah, that makes a lot of sense, Diane. A couple other just kind of minor things that came to mind. One is I was having a conversation with a client who was talking about getting a massage, and the massage therapist positioning their arm behind their back so that to really get into, I guess, the shoulders and loosen things up. And a client was talking about how when they were arrested, their arms were forced behind their backs and handcuffed. And so little things like that we probably wouldn't think of, subtle body postures, movements, especially if you're doing more active interventions like Thai massage and positioning the body in different ways that may mirror body positions related to different types of trauma. Those can really trigger implicit traumatic memories for folks. So I suggest just taking things slow, gradual, asking permission.
Yes. I think I like the taking thing. I move very slow and very, I'm very thoughtful with my movement. And I agree, just asking people before you move them. Because another thing that I know, and some of us know in the massage community too, is if you move someone too fast or in a weird way, they're not going to be able to relax. And you might even cause more harm than good. So really, when you are doing movements or you're moving someone's arm or doing anything, it should be done thoughtfully and gradually.
Absolutely. Yep. Thoughtfully, gradually, and with permission. Is it okay if I move your arm behind your back now?
Right.
Yeah.
So we have one person on here, Scott, but we're going to put your information up, if that's okay, if anyone wants to contact your center, or maybe even, I don't know who's in the Philadelphia area, but I'd be happy to put up your website. We do have one person who has some questions. Let me see.
Yeah.
Her daughter and mother both had trauma. There was no question there, but we'll put up your information, and if you can be helpful, we'll have your info. What else, Scott?
Yeah, absolutely. I would say another thing that could be helpful, going back to the earlier question you had about, as a massage therapist, if a client has an emotional reaction, what do I do? I think it can be helpful just to have a list of resources available.
Yes.
To refer out when needed. Wherever you're at, you can find local trauma therapists in your area. And, not all therapists just do talk therapy now. There's a lot of body therapies. Somatic experiencing is one specific one that's a trauma therapy. The creative arts therapies are more body oriented, which is what much of my background is in. And EMDR therapy is another one, which is a whole nother podcast, or a whole nother interview. But EMDR is eye movement desensitization and reprocessing. It's a really bad name, but a really effective trauma therapy that includes attunement to physical sensations, reprocessing memory. So I would suggest having a phone number, email on a sticky note in your drawer for a local EMDR therapist, a local trauma therapist, maybe some book recommendations. Bessel's book, The Body Keeps the Score, is a great one.
Every massage therapist should read that book. Everybody should read that book, I think.
Yeah, I agree. I recommend it all the time. There's some other books about trauma in the body. Peter Levine's work. Peter's the founder of Somatic Experiencing, which is a trauma therapy. He has a number of books. Gabor Mate has a book called When the Body Says No, which is looking at the stress disease connection. I think having some book recommendations and some referrals ready to go could be really helpful if someone has a response in a session and needs a little additional support that you might not be able to provide as a massage therapist.
People appreciate that. Like I said, the people who have had some time where they've had the tears or something major's happened, I have people to refer to. And Dr. Scott is one of my referral people.
Thank you. Appreciate it.
But there's only so much we can do as therapists, and there's only so much we can do by helping them with their bodies. It's all works together. And the name of the book that we were recommending is The Body Keeps Score. It's a brilliant book that I think massage therapists would read because it talks a lot about PTSD. It talks about how emotions are stored in the body. And one of the things, too, that I like about that book and helped me was almost, I could have ran with this one, but I chose not to totally run with it. But it even gives you relief from being fully responsible for your thoughts. Meaning after experiencing some traumatic experience, the way that we react to things might be a little off what we would like it to be. And we really have to accept that and then remanage those thoughts. Did I say that correctly, Scott?
Yeah, no, that makes sense. It's like the ways that trauma impacts people are normal responses to abnormal situations.
Right.
We develop what might be distorted thoughts about ourselves or the world, and that we have to renegotiate those in the process. But it's usually just our body and our mind trying to protect itself.
Yes. And let's not forget that. That's another one more. One. To the body. And it's like I've spent a greater part of my life in survival mode. It took me a long time to realize that I didn't have to survive anymore, that I had already survived. And as we're talking, my body, too, had to figure out that it could relax. It didn't need to survive anymore. So if my brain's thinking in a subliminal way that I need to protect, again, we're going back to those clients with those muscles that when you push on them, it's like you're pushing on a desk.
Right.
You can't, there's not much movement to them. And from this conversation more and more, I feel like, it could just be that repetitive thought and protect.
Exactly. It's like the psychological defense mechanisms, they also show up in the body in tension and really closing off the body.
Thank you.
And prolonged stress like that really breaks down different systems in the body, the immune system, the digestive system. It really is the connection between childhood adversity and the prolonged stress that it can cause. and all those medical conditions we talked about earlier that they found is correlated in the research. It's because the body is in a constant state of protection, survival, hyperarousal. And there's a way that you all as massage therapists can work with those symptoms in the body that us as trauma therapists, we can't do because we're not allowed to put our hands on our clients. So I think it can be amazingly helpful for all of our clients that we build partnerships, that psychotherapists build partnerships with massage therapists and massage therapists with psychotherapists and work together on cases. I know in my experience, I also work in an inpatient addictions treatment center, overseeing the trauma program. And we have a massage therapist who's a Reiki master, does acupressure, reflexology, and she runs the pain management program. And there is so much overlap between the clients in the trauma program and the pain management program. So much overlap. It's like anyone that has trauma would probably benefit from working with a body worker.
I can't tell you. This is like a dream, Dr. Scott, because there's, like I said, you have the voice. You might not have the hands. We have the hands, but we don't have the voice. And also our profession, unfortunately, I think it's getting better, but people don't take it as serious as I would like, and don't see the benefits as much as I would like. It's like a luxury, I picture robes and slippers, but it's so much more than that. And I just want to thank you for your years of hard work and commitment and perseverance, and the hard work you had to do on yourself to be where you are, to be able to help others with trauma. It's amazing. And I feel honored to have a chance to speak with you. And I feel like this conversation, I hope that this conversation helps gives our industry or people that watch feel more comfortable knowing that they are making a difference, even if it's not seen initially.
Right, that corrective emotional experience.
Corrective emotional experience. I love that. I'm going to take that onto my forehead. I think I might put it on my...
Get a tattoo.
I would love to give people corrective emotional experiences all day long.
Yeah. I bet you do. I bet you do more often than you realize.
I'm part of that.
Well, sorry, Diane. I was going to say, I really appreciate the invite to have this conversation with you and share a little bit about, what I've learned in the trauma field and kind of collaborate and co-create some ideas together and see how this might be helpful for some of your listeners. Yeah, and thank you for all of you do. I don't know where I would be without regular massage. It's really part of my self-care routine. And I wouldn't be able to do the work that I do as a therapist without the self-care that I need to do that.
100%.
So totally grateful for you and everything that you all do too.
And so you're basically, as a doctor, Dr. Scott, you're recommending that we all get massage, right? As massage therapists, we should definitely be getting massage.
I recommend it. Absolutely. You can say, Dr. Scott said that I should be getting a massage too.
Scott, thank you very much, everyone. I hope you enjoyed. This will be up on the page forever and ever. Enjoy it, watch it, learn from it. And Scott, Dr. Scott, if you would hang tight for a minute, we're going to end now. Dr. Scott, thank you so much for your time.
Thank you. Take care, everyone.